Hi, my name is Mahima Mehta, and I'm a Master of Public Health student at the University of Connecticut. I honestly feel like public health chose me. I always knew that I wanted to go into healthcare, and so when I went to UConn for undergrad, I majored in molecular and cell biology and really enjoyed it, and I was encouraged to pursue research. So surprisingly, I ended up in an ecology and evolutionary biology lab studying birds and parasites, which was completely random for me, but I loved it. And so I kind of got introduced to this concept of One Health, which is the idea that humans, animals, and the environment are all kind of interconnected and have an impact on one another. And while I really loved studying genetics, I also really loved learning about the environment and One Health. And so I kind of fell down a rabbit hole with the people in my lab, trying to see how can I connect these two things, and essentially learned that there is a field that does this, which is public health. And I realized this is really what my calling is. I need to kind of pursue this further and learn that UConn has a Masters of Public Health program, and really gravitated towards it in particular because it has a multidisciplinary approach. So knowing that our foundational courses kind of let me dip my toe in a lot of different aspects of public health was amazing, and yeah, I'm just so happy I chose it. The most surprising thing is that public health is literally everywhere. Prior to me being a graduate assistant in the program of Applied Public Health Sciences, I actually worked as a research assistant in a neurolab here. And I did a lot of research with mice colonies. We did brain surgeries trying to look at their hippocampal circuits, trying to understand just how memory is formed and essentially things with cognitive function, Alzheimer's, PTSD, depression. And coincidentally, the same time that I was doing this research, in my foundational courses, we were talking about the aging population and cognitive decline. And it kind of just sparked this realization that really everything I do touches on public health. Even though that is seemingly a wet lab, I am actively participating in public health research. And the knowledge that we're gaining from that lab is going to inform other people in public health in the decisions that they make. One of my most memorable and ongoing experiences at UConn has been my practicum. I am interning at Hartford Healthcare's Cancer Institute, focusing on increasing life-saving cancer screening access to minority populations. And this is just extremely rewarding because it's taking concepts that I'm learning in classes and directly getting to apply them. And this hands-on approach is probably one of the most profound things that has shaped me just as a student and as a person, because I get to kind of shadow my preceptor in her day-to-day life, but then also take on tasks that are normally assigned to her. And the conversations that I have with community members about the resources that they need and how we can provide them, how we can meet them where they're at, have just been amazing because it reinforces this concept that we learn about in class, which is that you don't come into communities and say, this is how we're going to fix you. You listen to the communities and you say, how can we help you? And it's just been amazing. My advice would be to equally engage in both the academics and the student life. Take your assignments seriously. This is work that you're actually going to be doing once you graduate out of the program, and probably even in your practicum experience. And in terms of student life, I highly recommend joining the Public Health Student Organization. This is really an excellent opportunity to engage with your classmates outside of a class setting and get to learn who they are just outside of assignments, which is crucial, especially in graduate school, to understand that student life is equally as important as graduate life.